Introducing Dr. Arun Rukadikar, the seasoned sage of mental health and the gentle guide through life's labyrinth. With a twinkle in his eyes and a comforting cup of chai in his hand, Dr. Rukadikar brings 5 decades of his experience and a touch of humor to his role as a community psychiatrist. He's not just treating patients, but he's transforming lives each day in his regular routine clinical practice. Sir, I really welcome you, and we are so honored to have you here with us today. How do you feel being a part of Pune and this entire work that you've built up till date?
Eklavya Foundation, I had heard about Eklavya Foundation quite a bit. And when I met Professor Vartak and his colleagues and office bearers and members of Eklavya Foundation, I found them to be very sincere in their work. They had their own support group for the patient's family members and caregivers. And they have a self-help group for the patient. And they are really doing some sincere work. And I was attracted to that work. And that is why we decided to collaborate with Eklavya Foundation for Mental Health.
So, sir, getting back to what we are here for today, I would like us to time travel back to the times where I really want to know how did you get into the field of psychiatry. I think your practice goes back for around 4 decades before, and what that time when psychiatry, social psychiatry, social work, mental health were so much of a taboo, or I think they were words just in the dictionary. That is the time you took up this noble quest to work in the field of mental health. So can you tell us about the journey that where you started from, and how did you land up where you are today?
I did my MBBS from Miraj Medical College and Wallace Hospital, Miraj.
Okay.
So when I finished my MBBS in 1968, we had to decide which postgraduate branch we are going to. At that time, Wallace Hospital has institutional need for a psychiatrist and radiologist. So I decided to take up psychiatry. At that time, the director of Wallace Hospital was Dr. A.G. Fletcher. He was professor of psychiatry. So he said, you cannot take psychiatry just like that. So you have to go to a center where psychiatry is being practiced. You work there and find out whether you are really interested.
Right.
So that's how I went to CMC Rathore.
Okay.
They have a very good setup, psychiatric setup. They have a mental health center and department of psychiatry. So I did my senior house surgery at mental health center in CMC Rathore.
Okay.
But when I was exposed there, I found that it was a very pleasant experience. Our teachers, Dr. Rod Chako, Dr. Abraham Varghese, Dr. K. Kurvila, were really extremely good teachers and extremely good human beings.
Right.
So they impressed me so much that I decided that I would take up psychiatry as my postgraduate studies and career in psychiatry.
Wow. So it was your professors who inspired you to make your inclination work towards the psychiatry, was it?
I feel so, because if I would not have worked at CMC Rathore, Department of Psychiatry, I might not have taken up psychiatry as my career.
So they, like how it's rightly said, that professors, teachers do influence you to make your careers in those fields. It stands true for you?
That is very true. That is very true.
So sir, that brings me more to my next question. As you've been working a lot with community mental health, community for caregivers, support groups. So the word community has been revolving a lot in our conversations lately.
say from WHO to famous sites of Indian sites like Vimans, everyone is talking about community work.
Yeah.
So, can you tell us exactly what consists of a community? Where does a community work start? Why community? And everything to do with the word community. So,
Community includes everybody in a given population.
okay.
So all the institutions of a community like schools, colleges, hospitals, all are included in the community.
Okay.
So community is the most important part of our life.
Absolutely.
So when we do something, the community gets benefited, or we do something harmful to the community, we harm the community. So community, we started our psychiatric practice in 1974 after post-graduation. As I was telling you, I did my senior house residency in 1969 at CMC Vellore, and then I did my DPM from National Institute of Mental Health and Neurosciences, Bangalore, from 1970 to 1972. And then I did my MD in psychiatry from King George's Medical College, Rathore.
Right.
So after passing out this examination, I joined Waterless Hospital in 1974.
Okay.
So the first 2 years of practice, what we found is that patients used to come to the psychiatrist very late. Maybe after 2 years, 3 years, or maybe longer than that. And they were trying to help the patient by taking him to government, by black magician. As if they used to say that this is some black magic somebody has done, that's why he has mental illness. So at that point we decided that patient's family members should realize that it is not scientific to say that it is because of black magic or planetary constellation had changed. Something is wrong with my kundali. All that sort of thing has to go. So at that time we started a group meeting for the family members and patients, and that was conducted by Mr. Vasant Holkar, who was psychiatric social worker then. So he used to take this group meeting so that all these superstition, misconceptions about psychiatric disorders and mental health should be dispelled from the minds of the patients and their family members. So Mr. Holkar took up a teaching assignment and resigned from the post of psychiatric social worker in 1980. So the group, it came to our responsibility that we should conduct the group meeting. So when we started to conduct this group meeting, we realized that patients and their family members did not have any idea about the nature of the illness their patient was suffering from. So we thought that this is something where we have to educate patients' family members about the nature of their illness. Because unless they understood what is the nature of patient's illness, they will not be able to help the patient to get well and remain well. So we started group meetings for the family members where we used to explain to them various types of mental disorders. And gradually this group meeting, family members started finding interesting because it made them understand why the patient is behaving in a particular way that he did or he does or she does. So that answered their questions. So they started their attitude towards patients also became very positive, and they felt that they can help the patient to get well and remain well. So they started asking us, how can we help them to get well and remain well? So we started telling them various interventions by which they can help the family members who have mental health issues or mental disorders, and how they can handle them or manage them effectively.
Wow, that each sentence that you have said, or each word you have said, is to be preached by individuals, and I think definitely the sense of community can increase. So, sir, while you're saying that the families used to take their members to uh, godmen or to the pujaris of the town or to XYZ people who are into religious beliefs and think that this illness comes from a religious place of the mind. So the culture and the community are a very like they're two hands of the same body. Can we say that? So, how do you think when so much of time goes into building of the illness, so much of time goes into the people to understand that something is not right with our family member, where do you think the psychoeducation for family members or for individuals, for communities can start from? Because I'm sure there would be some starting point where we understand what mental health is, to build up knowledge about what mental health is, what is the brain, what is the mind. So, where do you think is the right time to start understanding about mental health issues, disorders, human behavior, the separation from traditional beliefs to a scientific temperament or a psychological temperament per se?
I feel that it should start right from childhood and right from school. We keep teaching children that they should wash their hand, they should not hurt others, they should not fight with others. Find out the things where you get the things. If you find something there, you keep it in the same place. Don't mess up your room. Tidy your room. Or when you are crossing the road, hold each other's hand. Take care of each other. This we teach them right from the kindergarten. And this, whatever is learned in the kindergarten, it stays with you throughout your life.
Absolutely.
So when we talk to them about physical health, say washing hand before eating, things like that, or what to eat, what not to eat, all that thing we teach them. It's from the younger age group. Similarly, we have to sow the seeds of mental health right from that time. There should not be discrimination. You should not discriminate people on any basis, on the basis of religion, caste, creed, or gender, or race. All that things should be started right from the childhood. So I feel that mental health should be a part of curriculum right from the nursery to higher institutions of higher education.
Wow. I also wish that I could knew these things when I was in school, but nevertheless I got into the field with interest, and that made me understand what human behavior and mental health is all about. So sir, when we compare our country to the world around us, where do you think India stands today in terms of preaching these type of thoughts, understanding illnesses, getting it cured with a psychological temperament? So where is India in the picture of world map today?
I think in India, the mental health services are really not very up to the mark.
What is up to the mark?
Up to the mark means as a developed country, because of the non-availability of mental health professionals in India.
Right.
In India, there are at least 15 crore patients who have severe mental illness and who require psychiatric treatment. And there are another 15 to 20 crore patients who have minor mental illnesses or mental health issues. But there are only 7,000 to 9,000 psychiatrists in India and other mental health professionals, including clinical psychologists, psychiatric social workers, psychiatric nurses. So this thing, maybe India exports more psychiatrists to abroad than they are in India. So that is the situation. So naturally, 7,000 to 9,000 mental health professionals cannot take care of 30 to 35 crore patients.
Absolutely.
Or people who have mental health problems, mental disorders or mental health issues. So we have to do something about that. If these people are to be approached or helped to regain their mental balance and regain their mental health, and their mental health issues are solved or mental disorders are brought under control.
But sir, when you mention about the statistics or our place into the world, there are not enough jobs or there are not enough market for the field of mental health in India, is what a lot of people in the field have been talking about. So, in terms of when there is, say, a doctorate or a finance field or a field like law, the structures are quite set and everyone knows what kind of jobs they're going to land up, what kind of career they're going to make. So, for people who are coming from the field of psychology, how do you think they're not able to make a career in a place like India? Can you throw some light on that? Or why is that people are not staying back in the country? Because what I understand that Americas or like countries like developed countries, they have psychology seen as, or mental health, psychiatry is seen as a white collar job. So how is that in India, and where do you think we can create a market or create opportunities for individuals who are studying disorders, clinical psychology, counseling, social work, and fields like these?
I think governments have not realized the importance of mental illness in India. How the approach to mental illness and mental disorders, mental health issues is to be solved is the state governments as well as central government is not very sure.
Right.
So they are concentrating on mental hospitals and some institutions of higher learning like NIMANS and All India Institutes of Medical Sciences in various places. But grassroots level, you have to go to a grassroots level, even to the small towns, villages, that mental health service should reach there. So government has to think deeply about how they can do it. So I think unless they realize the importance of mental health in the national life, they will not be able to formulate a policy where clinical psychologists, psychiatric social workers, psychiatric nurses, even regular nurses, how much mental health work they can do. So unless these people are all made conscious about mental health aspect of community, the problem of about mental health issues is not going to solve.
Right. So, sir, can we say that Indians have still not developed a psychological temperament?
That is very true. They have not understood the importance of psychology in everyday life and how psychology can help or psychology can harm also. So people have not realized importance of counseling.
Right.
The counseling has to be, each school has to have a counselor, each college has to have a counselor,
Right.
because they do they can do so much of help to the students.
Right.
And students, whenever there is a stress,
Yes.
students definitely get affected by that.
Right.
So to improve their functioning capacity and try to help them to solve their own problem by counseling.
Right.
Government now has not understood the importance of this. So, and when they understand, they will create more and more these posts.
Yes.
And when they understand the importance of mental health in the country,
Right.
they will be able to improve the productivity, economy of the country as well. Because there is a very close relationship between the economy and the mental health of the population or mental health of the country.
Very rightly said, sir. Hearing all these thoughts, I'm sure there are foundations like ours, which is Eklavya Foundation, who has been working selflessly in terms of building a community for support groups, for a community of caregivers, for the patients, right? When the government brings in, I think we would also be in a very healthy position to collaborate with the government and build this on a bigger level, or take this across the globe. But in Pune, where Eklavya Foundation is doing this type of work, how do you think is contributing to the society, to the well-being, to the welfare, and how is it integral part that the foundation that is doing its work?
Eklavya Foundation is doing really good work by conducting support groups like caregivers group,
Right.
or and also self-help group for the patient,
Right.
where a patient can go and ventilate their feelings, tell their experience, share their experience.
Right.
And when the other people see people who have improved from the mental disorders or mental health issue, they also get inspiration. If he can get well, why can't I? So that is a really important type of work Eklavya is doing.
Right.
Another thing is family members are under stress. When there is anybody in the family has mental disorder or mental health issue. So their stress also need to be reduced. And Eklavya is trying to do it with support from a group for these caregivers. But there are very few institutions like Eklavya in other cities, other towns. I feel that each city, each town, there should be self-help group, self-support groups for the mentally ill.
Right.
And even in villages there should be. But that can happen only when the family members realize the importance of mental disorders, mental health in their life. And even society realizes how they can contribute for the supporting these mentally ill people or people with mental health issue, how they can prevent mental disorders by various interventions. That knowledge about that effectiveness of various mental intervention is lacking. And that mental health intervention can be at a personal level, it can be at a family level, it can be at a school level, it could be in societies, housing societies, it could be neighborhood level, it could be religious group level, it could be in various support groups, and it could be at a national level, at a state level as well as national level. So there are so many interventions that have been found to be effective for improving mental health or achieving mental health of the community.
Right. So, sir, many times there comes a question where people are really willing to help and they want to do something with the cause of mental health. They really understand. They want to be advocates. They want to be ambassadors, but they don't know how can they help or how can they be a part of communities or organizations like this. So where do you think they can start? So I think to give you an example, we have volunteers when there are blood donation camps happening. We have volunteers when the COVID vaccination was happening, where people used to come up and set up the booths and volunteer for causes like this. So when it comes to supporting foundations like Eklavya, how do you think we can create the bridge between the layman to become a volunteer or to get to know them? How can they, being a layman, can help organization like ours?
During blood donation camps, it is a easy thing for people to understand what is the importance of blood donation.
Right.
Similarly, during COVID, people realized that they have to help to try to control this epidemic. So, immunization they were helping. They were helping migrant people who were trying to run away from the village cities.
Yeah.
And they used to supply them food. They used to supply them transport
Right.
to go to various places. So that was a response to a disaster. But people have not realized that mental health issues or mental health disorders are also disasters. So that understanding has to come. Where amongst the epidemic of mental disorders in India. And it is very important for us to realize that all of us can do so many things to help people to reduce the incidence of mental disorders, prevent mental disorders, promote mental health. That understanding is not there. And that understanding has to be created by people working in social psychiatry, or even regular clinical psychiatrists have to take up this challenge to spread the message of community mental health in the community. And if there is a topic like mental health in the curriculum of the schools and colleges, it will definitely help. But the government has to realize the importance of that. But governments or people are busy about the contents of the various curricula. But they are not open to discussions like having community mental health as a subject for the studies right from nursery to the higher institutions of higher education.
Right. But the world where so many famous artists, so many famous politicians, so many famous individuals are talking about their mental health illnesses, and despite of that they're showing they're outperforming their jobs, and we're a country like us where we're still into the stigmatization of not including topics at school levels, at college levels. Where do you think something should break, or where do you think there can be a breakthrough for a country like us in 21st century, where we're still living some values and virtues from the 19th and the 20th century?
No, I feel government has to take an active part here. And I think the family is the first important group, because it is a family in which a person comes in contact. It's a small unit of society that a person is born in.
Right.
When person is born in, he is just a neurological apparatus.
Right.
But what he learns is mainly from family and later on from the society.
That's so important.
So, unless the family members are involved in
Right.
the proper upbringing of children,
Right.
educating them in various ways,
Right.
or helping them to not to discriminate right from childhood, have a very strong, good value system,
Right.
good eating habit, good exercise habit,
Right.
and importance of sports in life,
Right.
away from the screen time, away from the TV, mobile. It is very, very important that family has to play a very important role. That is why when in CMC Vellore, at Mental Health Center, when we were working there, when I started my house shop there, we found that the patient has to be admitted at least for 6 to 8 weeks.
Right.
And at least one significant family member has to stay with the patient throughout the period of hospitalization. Because unless family members realize how to handle these mentally ill people properly, they will not be able to help
Like the
patients at all.
focused, dedicated time just for this.
Yeah, to understand what they need to do.
Right.
So when we started our psychiatric practice in Miraj at Wanderers Hospital in 1974, we decided we'll follow the Vellore pattern.
Right.
That is, admitting the patient only if their family members are ready to stay with him throughout the hospitalization.
So I think something similar happened in COVID also, where people were admitted to the hospitals and the family members could not stay with them. So a lot of patients did feel betrayed or didn't feel a sense of belonging, didn't feel a sense of care. So a lot of them, passed away with that fear. So do you
That
think
is
there's-
very true. What you say is very true. Because all the patients who were isolated, they felt lonely. They had so many psychiatric problems.
Yeah.
But everybody was interested in the physical problem. Nobody took, there
Care
were
of
so
the
many
whole.
patients that there was no time to look after their psychological needs or even family members' psychological needs.
Yes.
So that was a really difficult situation at that point of time.
True. I think, sir, this conversation is going to go on like for the entire day or even for the week, because passionately we want people to think from the perspective of mental well-being, and that is still not reaching out in our bloods, reaching out in our thoughts, reaching out in our behavior, in our actions. So, but I'm so grateful that you were here today and you were able to spend this insight, your years of experience into what you have been doing in Mirrors, and we as a foundation, as a team, are really looking up to you to bring this type of work into Pune, or trying to reach out to the masses where they know that okay, we need help and they just know where to look at. So, sir, how can psychiatrists take care, or how can mental health practitioners can take care of themselves as they are practicing mental health professions?
I think it is a misconception that people who work in psychiatry develop psychiatric illness. It is not so.
Right.
See, some people may have developed burnout. Burnout rate in psychiatry is little higher than
Other
the
fields.
other fields of this thing. But apart from burnout, other psychiatric diseases are not contagious, or it is not a learned behavior. What you
Right.
see from the patient and
Right.
you start exhibiting that sort of behavior. It doesn't happen so. So it is more of a myth that psychiatrists themselves
Yes.
have psychiatric problems, or working in psychiatry they develop psychiatric problems.
So, sir, as we are progressing into more towards a patient-centric conversation, what is the role the family can play in the entire treatment of the patient?
Yes, this is a very important question, because most of the time, in majority of patients, family is the only caretaker for a psychiatric patients. And unless they are psychiatrically become mentally health literate, they will not be able to handle the patient properly. But those who take treatment from a psychiatrist or a support group, or the role of the family is very, very important, because role of the family can be in the causation of the mental illness as well as in the treatment of mental illness. With our experience, we have been working with the family for the last 50 years. Only when family is there, we treat the patient properly. We are able to treat patient properly. Because unless family members understand the scientific nature of the illness, and unless they look at mental illness as a purely scientific disorder, they will not be able to help the patient. Many times family members feel that it is evil possession, it is black magic, the planetary concept has changed. All those things are misconception, and that doesn't help in treatment of mental illness. So family has to realize what is the nature of the illness. Second thing, they have to change their attitude towards looking at patient. Many family members have misconception that patient is doing it purposely. He is trying to take revenge on them for something they did, or they feel that patient does not want to take responsibility, so he is acting this way, or doesn't want to do any work, wants to be a parasite on the family. That's why he is doing. But it is not so, because mental illness quite a lot of times causes willpower is reduced. So naturally, patient does not like to work. So unless the family members realize the nature of the illness and they change their attitude towards patient, members have to compassionate towards patient, and the family members also have to realize that patient is not behaving purposefully in this matter. Also, they have to learn how to handle patient effectively. And their wrong misperception can come in the way of properly handling the patient. So what we do is explain to the family members nature of the patient's illness repeatedly. So once they understand what is the nature of illness, then we proceed further and help them to understand what are the interventions at a family level they can institute to prevent a mental illness or to improve mental health. So that is also important this thing. But many times family members express their emotion in a very cruel manner. So they shout at the patient, they irritate the patient, they try to beat the patient. That doesn't help at all. On the contrary, it causes more problems. So they have to learn how to handle the patient properly. Another thing is they should reduce their high expressed emotion. They keep on telling the patient, your illness is causing so much of stigma to the family. You are not, don't go out because people will laugh at you. We are spending so much of money on your treatment. You are a burden to the society. So this type of high expressed emotion does make patient worse than what he is. And they stop listening to the family member or accepting any instruction from them. So family members have to learn how to handle the patient. Another thing is family members have their own personality problem. So that also comes in the patient getting well and remaining well. Family members, if there is a person with addiction, and that also creates the family's problems, and patient it affects the patient as well. If the patient is also addicted to, say, tobacco chewing or alcohol, and father also drinks and chews tobacco.
So it's,
If the father tells the son not to chew tobacco, not to drink alcohol, will he listen to them? So changes in the family members' attitude is very, very important. And unless they change, patient, they will not be able to help the patient to change. So that is why we involve family members in the treatment for the past 50 years.
50 years, big time. So, sir, as we have heard, I'm sure you have experienced, so have I, that it takes an entire village to raise a kid, right? So, same way, I think they would be needing more people for the treatment of the patient, the healing of the patient, apart from a psychiatrist and from the family members. So, who do you think can be a collaborative team, or what can be a collaborative team to actually heal the patient, to make the patient feel better?
I think National Institute of Mental Health and Neurosciences, Bangalore, they always insist that the team should consist a psychiatrist, a psychiatric social worker, a clinical psychologist, and psychiatric nurses. So they have courses for these people in months.
Okay.
But I feel that family members also should be involved in the treatment of the people, or the patients with mental disorders or patients with mental health issues. And even lay people should be involved in the counseling of the patients and this thing. Counseling is not something which really requires training lasting for years to be done.
Right.
It requires some training,
Yes.
but most important part of that training is empathy.
Right. Right.
And if you have a compassionate, a lay counselor has compassionate approach to the patient, he can do wonders with the patient.
You mentioned the role of counselors and lay counselors in this entire scenario. But what are the legal standings of these counselors according to the Mental Health Act 2017? Or how do they stand legally according to the law while they're giving this practice or giving this knowledge across communities?
It is unfortunate that Mental Health Act of 2017 does not mention about lay counselors at all. Because they feel that even trained counselors, say clinical psychologists or psychiatric social workers, unless they have registration with Rehabilitation Council of India, they cannot practice. I think it is a very restrictive practice, and that prevents other people in participating in the treatment program, including lay counselors. In developed countries, the concept of lay counselors is well accepted, but in India, that concept has not come in. And I feel that they should have some legal standing. They should be allowed to practice legally and help the patient. But because of fear of malpractice being brought in, these are not included. But it is high time that Indian Psychiatric Society think about it and recommend to the government about a change in the Mental Health Act of 2017, or revise that act, or formulate a new act to include even lay counselors.
So it should be more inclusive.
It has to be inclusive because the number of patients is such a large, and professional mental health workers are so few.
True.
It is very difficult to cope with the number of patients, or even people with mental health issues.
Right. True. So, sir, we spoke about the legal aspect, we spoke about the treatment aspect, we spoke about the process of how a team can help heal a patient and treat a patient. Coming to the part where we say that prevention is better than cure, do you think mental health is preventive and it can be prevented, or what do you have to say on the prevention part of mental disorders, mental health issues, and all
This
about it on a global stand for the Indian stand? What is that?
This is a very, very important question that you have asked me. Professor Norman Sartorius, he was former director of Mental Health Division of WHO. According to him, 1/3 to 1.5 people with mental disorders and neurological disorders are preventable. And this prevention can be done even in poor countries.
Right.
But the governments have not realized the importance of preventive aspect of the medicine, of the psychiatric disorders, and even psychiatrists are not very aware about this situation.
Right.
So if you institute proper interventions for prevention of mental disorder at a personal level, at a family level, at a community level, at a state level, and at a national level, definitely mental disorders can be prevented by these interventions, and also by promoting mental health. There are so many interventions you can not only prevent the mental disorders, you can promote your mental health.
Right.
So that is important, this thing.
Right.
So people don't realize how important it is, and the whole community has to be involved in mental health movement, and it has to be a movement of the community towards mental health. And only few psychiatrists, only 700 to 9,000, 7,000 to 9,000 psychiatrists will not be able to carry out this work. And mental health should become a community-centric topic rather than psychiatrist-centric topic.
Absolutely, sir. So well said. So since you have pioneered this kind of work 4 decades ago, and when we see, in my knowledge, the first epidemic was COVID-19, do you think there has been a shift in the mindset of people, in the shift of mindset of the community when this kind of work is concerned, or we still lack that level of awareness, or we are still there where we started, maybe you started when it was 40 years ago?
Yeah. For 40, 50 years ago, when we started practicing psychiatry at Wonders Hospital, Meters, there was stigma was much more than what it is today. Stigma has definitely reduced, but not to the extent where it should be reduced. Community people still look down upon people who have developmental disorders. All over the world, there are so many great people who have mental disorders or mental health issues, but they have done great things for the whole nation and the community and in their field of work. So many musicians had mental disorders, so many sports person had mental disorders, so many politicians had mental disorders. But in spite of that, they continue to do their work and excel in their field. Say, for example, Abraham Lincoln. He was depressed for many years. But when he became president, what he achieved, many other presidents could not have achieved.
Absolutely.
He did
Oh yeah, the black
slavery.
racism,
He
a
removed the
revolution.
slavery of black people, and he brought all the states together and made a United States of America.
Yeah.
So these are the two great achievements. he did in spite of having depression.
Right.
Even Sir Winston Churchill,
Mhm.
who was responsible for winning one of the important factors in winning Second World War,
Right.
he also had manic excitement as well as depression.
True.
He used to call his depression my black dog.
Yeah.
He used to say, my black dog is coming.
Right.
So there
Start
are
to
so
be
many
friends
great
in-
people who develop mental
Yes.
disorders.
Yes.
So this awareness should be there, and
Yes.
this should reduce stigma.
Yes. True. Right. Sir, this topic is very close to our heart, and very passionately you have been talking and sharing this information selflessly with us. I got to learn so many things from you today sitting here and understanding about how can I be a part of the community outreach, community service in terms of mental health education. And it has been honored to be with you, to see your work being pioneered, to being taken for 4 decades. And thank you so much for joining us. More to this, and I look forward to learning and hearing from you again.
Thank you very much.
Beginning of this video, we had mentioned that Sir is an author of a mental disorders in You book. This book talks about everything under the umbrella of mental health. This book is going to be useful for psychiatrists, for clinical psychologists, for counseling psychologists, nursing, clinical psychiatry social workers, NGOs, foundations who work in support groups, caregiving, family person, lay person, and everybody who needs to know everything about psychology, mental disorders. It is based on scientific study of ICD and DSM, and Sir has put in all his efforts, knowledge, and entire experience through great examples. So do have a look, and you can contact him for more details.